Today's lecture will cover medical emergencies. An emergency is a serious, sudden change in medical status that demands immediate attention in order to preserve life, avoid further harm, and obtain appropriate medical assistance as quickly as possible. Priorities include ensuring an open airway, controlling bleeding, taking measures to prevent or treat shock, attending to wounds or fractures, providing emotional support, and continually reevaluating and following up appropriately. An emergency cart is used during emergency situations, also known as a crash cart. It is important to know where it is located, what the contents are, and the organization of the contents. Sometimes the carts are labeled. An automatic external defibrillator, also known as an AED, can be used during emergencies. Public access to defibrillation has resulted in significant reduction in mortality from cardiac arrhythmia. There are two primary types of defibrillators. A fully automatic will analyze the heart rhythm, determine if a shock is necessary, deliver the shock. A semi-automatic defibrillator will analyze the heart rhythm, determine if a shock is necessary, and advise you to deliver the shock. If the emergency is involving head injuries, it is important to categorize the type of head injury. We can do this by looking at level of consciousness. Is the patient alert and responsive, drowsy and responsive to loud noise, unconscious and only responds to painful stimuli, comatose or unresponsive? In order to determine if the situation is deteriorating, we must assess initially and then continue to assess while working with the patient. If it has been determined that the situation is deteriorating, if it is severe enough, the procedure should be stopped until the patient is stable. Shock is a general term that indicates a failure of the circulatory system to support vital functions. Hypovolemic shock is caused by large amounts of blood loss. Septic shock is caused from massive infection. Neurogenic shock is caused by failure of arterial resistance. Cardiogenic shock is caused by heart failure or interference with heart function. Allergic shock, also known as anaphylaxis, is caused by exposure to foreign materials that the body is sensitive to. Psychologic shock is caused by post-traumatic stress, and syncope is an excessive fight or flight response. In order to recognize shock, some symptoms include restlessness, increased pulse, pallor, cool clammy skin, decreased blood pressure, decreased urination, and increased or shallow respirations. In order to prevent shock, we need to prevent any sudden change in body temperature, pain, stress, and anxiety. The technologist should work gently, calmly, and confidently. Anaphylactic shock is most commonly encountered because of contrast media. It can range from mild to severe. The most severe is death from cardiac arrest. The longer it takes to develop, the least severe it is. Mild reactions include urticaria, also known as hives, nausea, and vomiting. Generalized itching and hives are more serious because they're systemic reactions, and the most serious include laryngeal edema and cardiac arrest. Diabetic emergencies include diabetes insipidus, which is induced by problems with the kidneys or the pituitary gland that cause high glucose levels in the blood, resulting in excessive urination and thirst. Diabetes mellitus is the inability to metabolize blood glucose. Hyperglycemia is high blood sugar levels. Hypoglycemia is low blood sugar levels. A type 1 diabetic is insulin dependent, and a type 2 diabetic can be controlled by oral hypoglycemic meds, diet, and lifestyle. To support respiratory function, oxygen is administered by nasal cannula, intubation, tracheostomy, or a ventilator. A nasal cannula can typically provide 1 to 6 liters per minute of 24 to 45% concentration oxygen. A mask is used to deliver higher levels of oxygen, 6 to 10 liters per minute, 40 to 100% concentration. Intubation involves placement of any tube, typically into the trachea. A tracheostomy is a surgical opening through the anterior neck into the trachea. A ventilator is a mechanical respirator that controls respiratory rate, volume, and oxygen content. Suction is a mechanical device used to clear the mouth or throat. If the medical emergency is involving choking, we will use the Heimlich maneuver. For partial obstruction, a patient can still verbalize. Complete obstruction prevents speaking. The universal sign of choking is clutching hands to the throat and redness in the face. Encourage the patient to cough. If unsuccessful, administer the Heimlich maneuver. A cardiac arrest is a sudden stoppage of cardiac output and leads to permanent organ damage or death if not treated. It can be reduced by the use of CPR and an AED device. Cardiopulmonary resuscitation requires students to be certified. Brain function is impaired if deprived of oxygen for more than 4 to 6 minutes, and it must be initiated as soon as possible. A myocardial infarction occurs if a coronary artery is occluded. The area becomes ischemic, and the heart muscle struggles and potentially dies from the lack of blood flow. Angina pectoris is chest pain that is caused by insufficient oxygen supply. Cardiac arrest is the cessation or stoppage of the heartbeat. Defibrillation is electric shock that is used to reverse cardiac arrhythmias. Cardiopulmonary resuscitation provides ventilation and chest compressions to patients without those functions. Effective CPR provides 30 compressions to 2 breaths, which is approximately 80 to 100 compressions per minute. A cerebrovascular accident is a stroke or brain attack. It is more likely to occur in patients 75 years or older and if there is a history of a prior stroke. Some warning signs include paralysis on one or both sides, slurred speech or complete loss of speech, extreme dizziness, loss of vision, complete loss of consciousness. Report any of the above symptoms to a nurse or physician immediately. Minor medical emergencies include nausea and vomiting. The patient should be upright or lateral recumbent when vomiting to avoid aspiration. Epistaxis is a nosebleed. Lean the patient forward and pinch the affected nostril. If not effective after 15 minutes, get medical attention. Vertigo and syncope are dizziness and fainting. Change position slowly and remain recumbent until stable. A seizure is a brief loss of consciousness. Typically, patients experience an aura or a sense prior to the event occurring. It is important to move objects away from the patient to prevent an injury. If a patient experiences a fall, it is important to minimize the impact of the fall. A seizure is caused by a focal or generalized brain function disturbance that usually is accompanied by a loss of consciousness. The grand mal seizures are the major motor seizures. A focal seizure is less intense and it may cause severe uncontrolled tremors. Some medical emergencies may involve wounds. A hemorrhage is bleeding outside of a vessel, which we can apply a sterile bandage and pressure and place above the level of the heart if possible. A burn injury disrupts normal protective function of the skin, so maintain sterile precautions and provide gentle care. Dehiscence is when sutures separate, allowing abdominal contents to spill out of the peritoneal cavity. Do not attempt to replace the contents. Instead, place a sterile dressing to cover. place in a seated position, and obtain medical attention. There are various levels of trauma. Level 1 includes all levels of injuries and usually is found in large institutions. They must have physicians, surgeons, and support staff scheduled 24/7 and must be able to provide radiography, fluoroscopy, CT, and MRI exams 24/7. Level 2 trauma facilities have an emergency room physician, nurses, and radiology on staff 24/7, surgical, radiographic, and fluoroscopic procedures, angiography, CT, and MRI available 24/7. They are able to transfer to a Level 1 if necessary. A Level 3 trauma center has an emergency room physician and a radiographer on call at night, and trauma patients can be transferred if necessary. So examples of trauma include head injuries, spinal injuries, chest injuries, extremity injuries, wounds, and burns. There are 3 types of assessment. Respiratory assessment allows to determine if there is respiratory arrest or if breathing has stopped. Cardiac assessment determines cardiac arrest or if the heartbeat has stopped. And spinal assessment to avoid danger of paralysis. Triage is important to prioritize multiple injuries. A STAT is to be done at once. Any delay may jeopardize well-being, and it is of the highest priority. An ASAP, which is known as soon as possible, may be delayed for other tests, stabilization, and transport. An emergency response team is a designated group of healthcare workers who respond to emergency call systems. They utilize crash carts, which have medication supplies placed in patient care settings for quick access to medication and life-saving intervention. Medications include adrenaline, also known as epinephrine, amiodarone, atropine, calcium chloride, decadron, dextrose, dilantin, glucagon, heparin, isopril, Levophed, Narcan, nitrostat, sodium bicarbonate, solumedrol, sterile water, Valium, vasopressin, verapamil, and xylocaine. These are to be used dependent upon the emergency situation that arises. Some equipment that can be found on a crash cart involves a stethoscope, blood pressure cuff, a bag valve mask, a laryngoscope, endotracheal tubes, carbon dioxide detector, tongue blades, suction catheters, tracheostomy tubes, a flashlight, sterile and non-sterile gloves, a cardiac monitor, defibrillator, cut-down tray, a suction bottle, a hemostat, scissors, needles and syringes, IV solutions and tubing, IV cannulas, blood collection tubes, drugs, protective gowns, masks, and eyewear, and pen, paper, and a checklist for chart components. Assess patients and observe changes in clinical signs and conditions. The vital signs include blood pressure, pulse, respirations, and temperature. The Glasgow Coma Scale allows to assess motor function to see if the eyes are open, if there's a verbal response or a motor response. Other terms we need to be aware of. Vertigo is dizziness. Orthostatic hypotension means lightheadedness or dizziness caused by rapid change in position. Anoxia is a lack of oxygen. Epistaxis is a nosebleed, and nausea and vomiting are caused by an upset stomach and purging of stomach contents. In summaries, emergencies can arise at any given time. It is the radiographer's responsibility to monitor the patient and their condition while they are in the department. Know your responsibilities in emergency situations.